basically, comes from the Organization for Economic Cooperation and Development. OECD does a yearly kind of health report. It's really helpful to see the statistics they put together. I like this bar graph because it lists the countries on the left-hand side that have healthcare systems, and then, or some of the top OECD countries. And then it shows you how many of them are 100% universal. You'll see all those 100s starting at the bottom and going up. And it also shows you the mix of countries that finance their healthcare systems through public financing versus private. And the United States, which is the fourth one from the top, is an outlier in a few respects, in that being the wealthiest nation in the world, we still have a large proportion of our population that does not have coverage. And we also, have such a large proportion of our population that's covered with private health coverage. And so that's part of our problem. Let's go to the next slide. I often say that we're the only industrialized nation that really uses a market-based system for healthcare. This slide is a couple of years old, but the relationships stay the same. It's just that the total spending goes up in the U.S. It is, I think, over $10,000 per person per year that we're spending on healthcare total. But if you look at, the United Kingdom, Japan, France, Canada, other countries that have universal systems, you'll see that not only is the U.S. spending much more than they are in total spending, but in many cases we're spending more than twice as much as they are, and we're already spending more in public dollars alone through various mechanisms of taxes, our public health insurances, subsidies, and things like that. We're spending more in public dollars per person per year than most other of these countries do, and they have universal coverage. Let's go to the next slide. And why are we spending so much? One part of the problem is that we have a multi-payer system. It's very complicated. And this shows the growth. On the bottom line is the growth of physicians over time, and the red line is the growth of administrators. And you can see that coming into the managed care era, and then really going in gusto with private for-profit insurers, we have a huge administrative burden. And you'll see on the left-hand side that that's 3,000% growth in administrators. And this is all this different paperwork and stuff that has nothing to do with actual healthcare. Means that we spend more than, or around a third of our healthcare dollar on administration. And that's about, I've seen estimates anywhere from $450 billion to $700 billion a year. That's just on administration. Let's go to the next slide. And what do we get for that? This is a slide looking at over time at the number of people who are uninsured. And you can see that we were really heading into a crisis going into the healthcare reform process of 2009, 2010. And then the Affordable Care Act was passed in 2010. And the number of people without, insurance started to drop off. But that has hit kind of a plateau phase, and that's not expected to change significantly. Now, this was actually based on data before President Trump was elected, and over the past year alone, 3.5 million people net have lost their health insurance, primarily because of premiums rising and not being able to afford it. And I think with some of the changes that have been made recently, we can anticipate that the number of uninsured is going to start to go up, significantly. And this is pretty consistent with what we've seen at the state level. Every time there was a sort of a big universal health reform done at a state level, we saw a drop off in the uninsured for a short time, and then it leveled off and started to rise, and ultimately those systems failed. And we predict the same thing will happen at the federal level because we're trying to operate in this market-based system. Let's go to the next slide. And I just wanted to remind everyone about incomes and wages. So mean family income for each of the fifth kind of percentiles. So you can see the bottom 20% is that pink line at the bottom, and that stayed pretty stagnant, as have the other sections on this. The only one that's really rising is the top 20%. And so while we see health insurance premiums rising by 5, 10, 20, sometimes 40% in a year, we see out-of-pocket costs rising significantly each year, so that families have to spend, thousands of dollars in deductibles before their health insurance kicks in. All of this is happening while we see a flattening, of family income. And so it's each year it creates a bigger burden for families to pay for their health care. Let's go to the next slide. And that's why we see that medical illness is the number one cause of personal bankruptcies. And the most people who go into medical bankruptcy actually had some form of health insurance when they started their illness. So we think of health insurance as an umbrella that melts in the rain. When you need it, it's not there for you.